In today's episode, we go over physical therapy treatment for radicular lower back pain during squats, deadlifts, and Olympic lifts. Welcome to the Fitness Pain-Free Show, where I help physical therapists learn how to get their clients out of pain and back to training in the gym. My name is Dan Pope, and I'll be your instructor. I'm a physical therapist, coach, and fellow meathead. I love training just as much as you do and want to help you get all of your patients out of pain and back to the gym where they belong. First and foremost, thank you so much for your support. You truly allow me to do what I love for a living. My name is Dan Pope. I'm a physical therapist. I'm a coach, personal trainer, and meathead. I love training. I love the gym. I love all things fitness. This is the Fitness Pain-Free Show, where we help coaches and physical therapists like you get your patients out of pain and back to training. If you're watching this on YouTube, please hit that like button, comment, and subscribe to the channel. If you're listening via podcast, please leave a positive rating and review. It helps a ton for me. If you want to go that extra step and support me further, please consider subscribing to Fitness Pain-Free Insiders. It's a comprehensive educational resource and toolkit for the fitness and rehab professional. Think Netflix, but for trainers and physical therapists. It's premium content developed by yours truly, very similar to the topics you'll see in the Fitness Pain-Free Show. I update this every month. I've been doing this for 5 to 6 years. It's got over 100 webinars, ebooks, and complete guides. You have access to a private Facebook group to have all of your questions answered by me. You can also decide upcoming podcast topics like the one I'm doing today. It was decided by someone from Insiders. You can get started for $1. It's only $1 for a week's trial. And afterwards, it's $9.99. So very, very cheap. I'm going to leave a link in the show notes. However, all you have to do to sign up is to go to fitnesspainfree.com, click on the programs link, click on Fitness Pain-Free Insiders Online Library, and get started. So the topic of the day, we're talking about radicular lower back pain. What is radicular low back pain? Well, here's the definition. It is pain evoked from a dorsal root or its ganglion, right? So you have nerves that exit the spine and they travel out through small holes in the vertebrae called the intervertebral foramen. You can have an injury to the nerve, irritation to the nerve where it exits, all right? The most common cause of radicular pain is going to be what's called a disc herniation. So basically the inside of the disc pokes through to the outside of the disc, right? And you will potentially have some compression of the nerve. So the disc will push up against that nerve, or you'll have some irritation of the nerve because of inflammation from injury of the disc, right? And you can have some associated radiculopathy of this, which means you have compression of the nerve, like I said, and you can have an injury to the disc itself. So it's not just the inflammation of the material coming out from the disc. It could actually be the disc injury itself is painful, right? So you can have an injury to the disc that hurts, or you can have an injury to the nerve or irritation of the nerve right outside of the disc, right? This is potentially worse, with spinal flexion and compression. So I work with a lot of folks in the gym. So usually the bottom of a squat or a deadlift is what gives people the most trouble. That's a combination of flexion and compression. However, it can be a variety of other positions that also hurt quite a bit. Oftentimes, it's associated with dermatomal or myotomal issues. And what that means is you can have some numbness and or tingling, as well as some weakness. And I want to show you this image. So if you're listening to this, I apologize, but I'm just showing the spinal canal, which is a series of vertebrae that are stacked on top of one another. And in between the vertebrae, you'll see the disc, right? And this image I have outlined here, if you can't see it, go to YouTube and check it out. I know a lot of listeners are on podcast versions of this. You'll see one of the discs has pushed out from where it normally belongs, and you actually have the nerves right along this area here, right? If we look at the image over to the left, this is a vertical view. So think about looking straight down at the spine from the top of your head and taking a section. So we took a cross out of the spine, and now we're looking at the vertebrae and the disc from above. And you'll see here's the intervertebral disc, right? Here's the vertebrae. These are the spinous processes, or the things that stick out the back. If you run your hand down the back of your spine, you'll feel these little bumps. Those are the spinous processes. That's what this is right here. And within the disc, you have the inside, the nucleus propulsus. And on the outside, you have the annulus fibrosus, or the wall of the disc. In a disc herniation, the inside material, the nucleus propulsus, pushes outside of the disc wall, which is the annulus fibrosus. And what you'll notice is that that nerve lies right in the intervertebral foramen where the disc herniation can occur. You can see pretty easily how there could be some compression on the nerves that leave the spinal canal, as well as a potential irritation of any sort of inflammation that gets stirred up as a result of this injury, right? So now that we know what radicular low back pain is, let's talk about some principles of radicular low back pain, right? What are the primary symptoms? So usually you're going to have some sort of pain with combined flexion and compression. Now, I say usually because most of the folks that I work with will get hurt in the bottom of a squat or the bottom of a deadlift. And that's going to be compressing the spine, right? Because you're holding a weight in your hands, or weight's going to be on your back, combined with flexion, because in the bottom of those movements, there's going to be lumbar flexion, right? So this is usually, it's not always the case. Some folks that have disc pathology or disc-related pain, radicular base low back pain, they hurt more in extension, right? So it doesn't always have to be flexion, but I will say the majority is flexion and compression. The other interesting aspect of radicular base low back pain is these folks will typically have what's called neural tension, right? So nerves are irritated, and because of this, they don't like to be stretched. So I've got an image here of a slump test. So when someone sits, sticks one leg straight out, dorsiflex the ankle, and brings the chin down to the chest, we are stretching all of the nerves from the brain down to the foot. And if they're irritated, you're going to have some trouble with this movement right here, right? The other thing I notice frequently with these folks, oftentimes they have pain down one side of the leg, right? So they'll have issues on either the right or the left side, hip, glute, somewhere down the leg, sometimes into the foot and ankle. And it may hurt to load that involved side. So these folks may not be able to handle a whole lot of flexion and compression of the spine. So think about squats and deadlifts, especially heavy, but it might actually hurt more to load one side leg over the other, right? The other thing you'll often see is dermatomal issues or myotomal weaknesses, right? So you might have a loss of sensation, altered sensation, paresthesia somewhere down the lower body. You might also have some weakness, right? Either in the ankle, knee, hip, it could be anywhere in the lower extremity, depending on where this injury is, right? The classic ones where we tend to see weakness going to be the tib anterior. So when someone takes a step, they can't control their foot. They call this foot drop. The foot kind of slaps the ground every time they take a step, just because they no longer have great neural connection because of the injury at the nerve that occurred earlier. So here's some radicular low back pain stats. So 63 to 72% of patients have radicular low back pain experience some sort of paresthesia or abnormal sensation. 35% experience radiation of pain in the lower limbs, so some sort of radiating pain that goes down the leg. 27% of those folks are going to experience some numbness, right? 37% of those folks are going to have some sort of muscle weakness. 40% of those folks are going to have absent ankle reflexes, and about 18% have absent knee reflexes. So if you do your reflex testing at the Achilles, at the patellar tendon, you may find that you get no reflex whatsoever in those folks, all right? Now, I'm getting ahead of myself a little bit, but the whole reason why you're here is because we want to learn more about radicular issues, but also how do we solve them and get back to the gym, right? So initially, we want to try to unload flexion and compression and or decrease some of that neural tension, because someone does not feel good when you stretch those nerves and also feels poor to get into a flex posture, right? So we want to unload those positions initially, and then we gradually work our way back into flexion and compression and also increase the amount of neural tension over the course of time, right? And I'll show you exactly how to do that. Before we do, I think it's very important to talk a little about medical red flags, okay? And this is especially true with radicular issues, okay? So anytime that you have lower back pain, we have to be on the lookout for these things. And if you're noticing any of these, we have to refer out immediately and to go see a physician, okay? It could be something more serious going on. So the first one to be cautious with is going to be saddle paresthesia. So abnormal sensation, numbness, or tingling in any area in the groin, kind of like when you're sitting on a bike seat, any area where that bike seat would touch. If you have any sort of paresthesia in that area, a reason to refer out immediately. If you have a history of a major trauma, so you just came from a car accident, you fell from some sort of height, so you're climbing a tree and you fall on your back or something along those lines, or you had a direct blow to your spine and you have a whole bunch of low back pain, refer out. If you have associated abdominal or groin pain, could be some sort of visceral issue, right? Go get it checked out. If you have a fever, swelling over the spine, if you have urine retention, so basically can't pee, you have fecal incontinence, so basically you're pooping your pants, and again, numbness, tingling, or abnormal sensations in the groin area, go see the doc. The next one is going to be worsening weakness, numbness, or tingling in the lower body, right? And the big one here is going to be weakness. So here's the problem. If you have a major injury to a nerve in the lower back, that can decrease the transmission of the nerve to the muscles, so the muscles get weaker, right? If that's getting progressively worse over the course of time, that's a bad sign. It means you definitely need to go see the doctor, right? A lot of folks will have a little bit of weakness, and that will probably get better over the course of time. But if we have gross weakness, right, especially if it's worsening, definitely go see the doc, right? If you have constant pain not affected by position or activity, especially if it's worse at night, go see the doc. Could be a sign of cancer. If you have a history of cancer, obviously same thing. Unexplained weight loss or no relief with bed rest, got to go see the doctor right away. And when I read through these red flags, it's funny because it scares me, right? I get a little bit nervous, but here's what I will say. A large majority of low back pain and radicular low back pain is not an emergent situation. You don't need to see the doctor right away. It definitely seems that way. Obviously, it hurts a lot. It's very scary. But generally speaking, this is something that improves over the course of time. And we don't need to see the doctor right away. Okay. However, when in doubt, get it checked out. If you have any concern that your patient's not improving, right, and you think that they have something funky going on, go send them to the physician. Okay. No reason to hold back. Okay. What are the most common causes of radicular low back pain? And you guys know me, I'm fitness pain free, right? I'm talking about fitness. I'm talking about strength training. I'm talking about causes of radicular pain in people that love to train in the gym. So what are these causes? Well, generally speaking, it's going to be some sort of squatting, deadlifting, or Olympic weightlifting. Now, how do we know this, right? Well, the data is actually pretty clear. So if you look at some of the survey data in powerlifting, regular weight training, Olympic weightlifting, and strongman, low back pain is going to rank somewhere between 1 and 3 in terms of the most injured area in the body, right? And the most common forms of low back pain that's reported in these weight training populations are going to be muscle strains and then disc bulges and herniations. So at least in this study, and I'll give you the references in the show notes, you can definitely check it out. Muscle strains made up 44% of injuries where there was non-radiating pain. So basically just pain somewhere in the low back, but nothing down the leg. And then in disc bulge and herniation, 54% of the injuries there had some sort of radiating pain, right? And here's the thing. When I read that study, that was, I don't want to say alarming to me, but it was illuminating, right? Because I would say the large majority of low back pain that I see is not radiating in nature. Usually it's very local, right? But this was saying that over half of the pain present in a weight training population was radiating in nature. So somewhere down the leg, okay? Now, if you have radiating pain going down the leg, that doesn't mean automatically you have radiculopathy, radicular pain, although it could, right? So what I will say is that majority of folks who hurt themselves in the gym and get low back pain probably aren't having radicular pain. However, you definitely will see some, and maybe more than I think, right? In the general population, so in folks that don't train in the gym, disc herniation is underlying etiology of less than 5% of patients with acute low back pain. So most folks don't have radiculopathy, radicular issues in the lower extremity associated with some sort of nerve pathology when they have low back pain, all right? However, you will see it from time to time, especially if you're working for these folks for long enough, right? And here's the other thing. These numbers are pretty consistent with my observation. Like I said, most of the folks I see are probably not dealing with radicular pain when they have low back issues, right? But what I will say is the number one offenders for most folks to get low back pain in the gym, probably going to be squats and deadlifts, right? I know that everyone loves squats and deadlifts, and I do too. However, I will say it's one of the biggest offenders when folks come to me and say they hurt themselves doing something in the gym, their lower back hurts. I say, well, squats, deadlifts, how are those going? It's like, oh yeah, I hurt myself doing squats or I hurt myself doing deadlifts. Now I can't squat and I can't deadlift, right? So those are the biggest issues surrounding radicular-based low back pain. What are the causes of radicular lower back pain? Now, again, I'm speaking about folks in the gym. I'm not talking about the average person that doesn't work out whatsoever, right? I'm talking about folks that like to lift heavy weights, okay? And here's what I will say. Injury onset is complex and multifactorial, right? So there are a lot of reasons why you can hurt your lower back. And what I'm doing is I'm extrapolating this from other sports injury research. You're not going to see a million research studies that are all specific to people that like to weight train in the gym, right? You're going to see a lot of studies that are based on other types of athletes, and I'm going to be drawing information from them, right? So one possible way that you can get low back pain is by introducing a weightlifting program or any other intense lower body training program too quickly, right? So basically, if you're not prepared for a given program and you jump straight into it, you're more likely to get hurt, right? So let's say you're trying a small off squat cycle or something along those lines. You're used to squatting once a week, and all of a sudden you're squatting 4 or 5 times a week. You're a little bit more likely to get hurt just because your body's not prepared for that program, right? Same thing goes for being a novice trainee. So if you've been training for less than 6 months to about a year, right, based on the research that I'm citing here, and again, you can check that out. It's going to be in the show notes. You're more likely to get an injury, and it's just because your body's not really prepared for that stress yet. It takes a long time to build that tolerance, right? Nothing that can create some pain and problems is a lack of consistency with training. So let's say you train 3 to 4 times a week for a few weeks, and all of a sudden you get pretty busy and you're only able to train 1 or 2 times a week for a few weeks. And then you go back to the gym and you're trying to make up for that loss of time. So you start doing 4 to 5 days per week worth of training. All of a sudden you get hurt just because you had a period of time where you deloaded, right? Deconditioned your body, and then you try to ramp back up again all of a sudden and you get hurt, right? The last one is just excessive training volume. So a lot of folks want to try whatever hot new program out there to improve their deadlift or their squat, and it might just be too much total volume and or intensity for the body to handle, right? And because of that, you can get hurt. Okay. Another anecdote I want to say, and we'll get to this in a minute, is that most folks believe that technique is the main driver behind low back pain, right? Especially radicular low back pain. And we're not going to go too deep into technique as it relates to low back pain because that's a huge ball of wax. But you may have some technical issues that could be leading to someone's pain. But just going through these 4 factors here, you can obviously see that there's a lot of reasons why you can potentially get hurt. And it's not as easy as my technique was off and that's why I got hurt, right? So classically, from Stu McGill's research, where he was bending pig spines, what they found is that if you combine flexion and compression in a pig spine for thousands of repetitions, you create more disc pathology by combining compression with flexion, as opposed to just compressing a pig spine. And this is where, and there's a lot of hubbub around this whole thing, but basically the whole idea of flexion and compression causing disc pathology, disc issues, and potentially radicular issues. A lot of that came from Stuart McGill's original research, right? And I think it's important to understand the study was basically taking pig spines and either compressing them or compressing and flexing them, right? And the ones where you compress and flex, they had slightly more injury, right? However, the ones that just got compressed got injury as well. But when people talk about not rounding your lower back when you deadlift or squat, this is the reason why, for the most part, right? There's other research studies that try to look at this as well, but this is a major reason why people believe discs get herniated in the bottom of a squat or deadlift, because we don't have good technique. We're not keeping a neutral spine. Topic for another day. All right. I think it's way more complex than just that, but that is a potential reason why people get some disc issues within their spine. Okay. Another thing that can lead to injuries are spikes in training volumes, right? So think about, let's say New Year's just crossed a couple weeks ago. A lot of folks aren't used to exercising very frequently, and all of a sudden their New Year's resolutions are to go to the gym 5 days a week. They start going 5 days a week. Good for you. I think that's a great thing. However, you just spiked your training volume. You're now training way more than you normally do, and you're a little more likely to get hurt because of that, right? What else can be related to lower back pain? A lack of coaching, or having poor coach/athlete relationships. So lack of coaching makes total sense, right? So if you don't have someone telling you the sets and the reps, when to do this exercise, when to do that exercise, how to program over the course of time, not giving you any feedback on how to do the lifts appropriately, you're a little more likely to get hurt, right? And the other piece is that if you don't have a good relationship with your coach, so I know most folks in the gym don't have a coach, but if you do, you don't talk about your injuries and talk about what's giving you issue, right? Your coach is not very likely to try to modify things so you don't hurt yourself further over the course of time. Another thing that has a pretty good correlation to injury is going to be recovery, right? So if you don't do a good job of your nutrition, you don't do a good job of sleeping enough at night, if you're really bad at managing stress or you don't have enough recovery days between sessions, that might cause a low back issue as well. The other thing that can, create some issues is going to be not taking prior lower back injuries into account, right? And I really, really like this book. It's called The Body Keeps the Score. It was authored by a guy by the name of Bessel van der Kolk. I'm sorry, Bessel van der Kolk. I always botch the name. I apologize. It's actually a book on PTSD, all right? So not the most relevant to orthopedic injuries in the gym, but the theme of that book is the body remembers old injuries, right? So if you have a deadlift injury from 5 years ago, your body remembers that old injury, and it's a little bit more apt to create pain again in the future just to protect you because your body doesn't want to repeat the past mistakes, right? So if you have a prior injury, right, especially low back pain, we know that tends to recur over the course of time, you're a little more likely to experience more pain in the future, right? The other thing that can cause radicular low back pain is going to be a particular psychological profile or characteristics. And these profiles are going to reflect your choices of what you end up doing in the gym in terms of how much weight you use, how likely you are to push through pain, those types of things. And one big one that does correlate with injury is going to be the high athletic identity, right? So if you identify as a super strong person, super fit person, you think your sense of worth is all wrapped up in your ability to be a strong person, right? A very fit person, then you're likely to push through pain if you have an injury, just because an injury is going to be a major threat to your sense of self. If the reason why you think you're a good person in this world and have value as an individual is because you have a big deadlift, right? If you have low back pain, that is a major threat to your sense of self, right? So you're probably likely to deny that pain and just continue pushing forward because you don't want to have an injury to eat away at your sense of self, right? Or to have some sort of knock on your sense of self. The other psychological characteristic that does correlate with injury is perfectionism. And I think the thought here is that if you're a perfectionist, you just feel like you always have to do what's written on the program for that day. And you want to be perfect about your training. You want to try to do as well as you possibly can, because being a perfectionist has a lot of pros, right? If you do everything extremely well, then that's going to work out pretty good for you in life in general, not just with training, but it's going to allow you to make better progress over the course of time, obviously. But it also is a bit of a double-edged sword, because if you're a perfectionist and your body is not feeling good and you really want to get through that workout and kind of hit those numbers you're supposed to hit for that day, you're a little more apt to push through that pain because you want to have a perfect day, right? Perfect training, right? And the last one is working through a less severe injury. And this one's actually pretty cool. And you can check out the citation again in the show notes, but I'm thinking about a study in soccer players. And what they were showing is that if you had an injury that wasn't that bad, so it wasn't causing you to stop training at all, right? So you can still train through this injury, called a non-time loss injury. If you train through a non-time loss injury, you're much more likely to get a more severe injury. And that could be in the same area where pain is currently. So let's say that you tweak your hamstring, right, and keep training, that could turn into a more severe hamstring injury. However, it can also turn into a more severe injury somewhere else. Okay. So if you're working through injuries, there's a good chance it's going to get worse over the course of time, right? And here's the thing. This lecture series is not designed to be an educational course on how people can get hurt in the gym. If you guys want an educational course on how people get hurt in the gym, I have a free mini course. It's called the Fitness Pain Free Mini Course. And I'll go over a lecture called 7 Reasons Why People Get Hurt in the Gym and what to do about it. And I'll leave that in the show notes if you want to check it out. All right. So what fixes radicular low back pain? Well, first and foremost, the thing that fixes radicular low back pain more than anything else is just time. All right. And this is actually pretty cool. I think this is a good thing, right? So most cases spontaneously improve over the course of time, right? And I'm going to take some research here and read it from you. This is from Chunchia et al. Sorry, I probably butchered that name, from Clinical Rehabilitation 2014. And they were looking at spontaneous recovery of lumbar disc herniations, right? So the rate of herniated disc becoming smaller over the course of time was 96% for sequestrated discs, 70% for extruded discs, 41% for protruded discs, and 13% for bulging discs, right? So I know I didn't educate you about the different types of disc injuries, but the worse the disc injury was, the better the healing was over the course of time. All right. So the large majority of radicular low back pain and disc injuries improve over the course of time. Okay. And it doesn't really matter what you do, they just tend to get better. All right. So that's a really cool thing, because radicular low back pain can be extremely scary, right? However, if you don't have one of those medical red flags, then it's going to get better over the course of time and you don't have to worry about it, right? The other thing that tends to work well with radicular low back pain, but really any sort of low back pain, is going to be some sort of active treatment, right? And what I mean by that is not laying in bed. Bed rest is not something that's going to improve your low back pain. We want to stay active. So that means when you have an injury, you want to keep going to work, you want to keep going to the gym, you want to keep going about with your life as much as you possibly can. All right. And my preference for treating lower back pain for folks that want to get back to the gym is through weight training, right? However, you have to be a little bit cautious here because you are fighting fire with fire, right? So the cause of the injury is exercise or strength training, but the solution is also going to be weight training, right? So the cause is also the cure, okay? We have quite a bit of research to support this. And again, most of this research is not in radicular low back pain. It's more in regular low back pain. Okay. So take that with a grain of salt. But strength training helps reduce low back pain. And here's the thing: lower body strength training does. It contains squats and deadlifts, right? And for the majority of folks I work with, they want to get back to squatting and deadlifting anyway. Okay. So it's a two birds with one stone situation. We want to squat, we want to deadlift. Okay, great. You can continue. We have to be cautious about the way we do it. And the squatting and the deadlift will actually heal the lower back, right? And again, we have to be a little cautious. We have one study in particular, again, shown in the link in the show notes, that if your back is very irritable, you're probably not going to do well with heavy deadlifts, right? And obviously that's a no-brainer. If your back is killing you, you're probably not going to be able to deadlift heavy anyway. But over the course of time, as the back feels a bit better, we can introduce more deadlift type movements. And I'll show you how to do this in the future. And the last piece is that strength training also reduces recurrence rates with low back pain. One of the things that stinks about low back pain is that once you have it, there's a chance you're going to get more low back pain in the future, right? And we know that if we add some strength training on a regular basis, that's going to reduce the likelihood that your pain recurs. Okay. So great. Another reason why we want to strength train when we have low back issues. So let's go over some radicular low back pain principles to help you out with rehabilitation, right? So first and foremost, we already talked about radicular low back pain creating neural tension issues. So basically, my nerve doesn't like to be stretched. Okay. So these folks often have a positive slump test, a positive straight leg raise test. And this is going to greatly limit your ability to hinge. So deadlift movements are one of the hardest things for your lower back when you have radicular low back pain, right? But the other piece is it may limit lunge and other single leg variations if it's bad enough. Because if you think about a split squat, when I get to the top of a split squat, I'm straightening out my leg in the front, and that might be enough stretch that my body really doesn't like that. Okay. The other thing to keep in mind is that sometimes these folks can't load either one side or the other side leg. So despite not stretching the nerve too much with some of our exercises, we might have to really limit the amount of total load that we throw on one side leg or the other just because of the pain the patient's experiencing. So what can we do to decrease some of the neural tension in the gym and train without aggravating the area, right? So we can reduce neural tension by slacking the nerve at the hip, the knee, or the ankle. And we do that by reducing the range of motion with hip hinging, right? So if you think about the difference of a rack pull versus a deadlift, if you're pulling from the floor, you're going to flex the hip a little bit more. You're going to tension the nerve some, right? If we pull a little bit higher, so a rack pull, we're not tensioning the nerve as much. We're slacking the nerve. So we can probably get away with a little bit more deadlifting from a rack pull perspective compared to a deadlift from the floor, right? We can also add a little more slack by adding knee flexion. So if I choose a trap bar deadlift, I'm not going to have as much neural tension because my knee is bending a little bit more and I'm getting a little more slack of the nerves behind the knee, as opposed to a conventional deadlift, which initially is probably going to be harder to tolerate. We can also reduce neural tension during single-legged exercises, okay? So one little trick I use a lot for my patients with a radicular low back pain is I add a heel lift. Okay. You can also use an Olympic weightlifting shoe. But what this does is it's going to slack the ankle slightly when I'm doing things like split squats and lunges. Okay. The reason being is I'm plantar flexing a little bit, and plantar flexion will reduce neural tension. Okay. The other thing you can look towards doing is shorten the stride during lunges. And if you shorten the stride during a lunge, when you fully extend and you're at the top portion of the lunge, you won't have an aggressive stretch on the nerve behind the leg. Okay. The other piece you can do is just not hit end range. So if we go to the very bottom of a lunge and we come about halfway and right back down again, this is not the way you want to train for your entire life. But while your pain's going down, it's a nice way to continue training, getting a training effect without irritating the nerve. Okay. So how do we handle this from a rehab perspective? So if you have an aggravated nerve, we want to start with exercises that have a low level of neural stretch. So that means choosing squats over deadlifts. It means choosing lunges and step-up variations over single-legged deadlift variations. And over the course of time, we're trying to progress into more stretch. Okay. So maybe we start with a high handle trap bar deadlift, which is a low level of neural tension. We progress to a low handle trap bar, a little more. We progress to a barbell rack pull, a little more stretch. And then we progress all the way to a conventional barbell deadlift from the floor. What increases stress on the spine in general? Because when you have radicular low back pain, the spine tends not to handle a lot of stress. So the first one is increasing torso inclination, right? So if I'm doing a back squat and I'm seating my hips really far back, I'm going to incline my torso forward. It's a little more shear force in the spine, and it's a little tougher for the back to handle. Okay. In the same scenario, if I sit my hips really far back, I create a larger hip moment arm, right? From my center of mass to my hip. And that makes the motion harder for my hip and my spine. Contrary, if I do, let's say, a goblet squat and I elevate my heels, and when I squat, I sit down and allow my knees to travel forward, I actually create a large moment arm for my knee and my knee extensors. So I actually work my quads a lot more in this scenario as opposed to a back squat, right? The hip moment arm in a goblet squat with the heel elevated is actually quite small because your quad and your knee is doing the majority of the work, right? The other thing that affects spinal stress is the degree of spinal motion. So if I go really, really deep into a squat or really, really deep into a deadlift, I have to move the spine more. I have to flex the spine more as I get to the bottom range. And most folks have radicular low back pain. They tend not to handle flexion and compression really well. So the deeper I go into a deadlift or squat, the more flexion I'm going to get. Okay. The other piece is load. So if my back is bothering me, heavy loads tend not to feel great. So oftentimes we have to reduce the load, and that could be by knocking a little bit of weight off the bar, could be by using different variations of lifts. So a barbell back squat, you can load up really heavy, as opposed to a goblet squat, we really can't load up that heavy because you have to hold the weight out in front of you, and you're kind of limited by the amount of weight you can hold out in front of you as opposed to your legs, right? And the last one is just going to be speed of movement, right? And this is really relevant for Olympic lifts. So a lot of spines can handle a little bit of stress if you apply that load slowly. And that's often why I love tempo exercises for folks in pain. As soon as you start moving that barbell faster, that pain spikes. Okay. So think about Olympic weightlifting. Cleans, snatches have a lot of speed. When you have a bunch of low back pain, your spine often doesn't tolerate that. So we'll have to slow down these movements a little bit and temporarily get rid of them potentially. I'll show you some ways of modifying in the future in order to allow the area to calm down and heal over the course of time. Now, again, this lecture is not supposed to be all about exercise prescription for low back pain, but I actually have a very in-depth lecture series on exercise prescription for lower back pain and fitness pain-free insiders. So that's going to be in the show notes. You can check it out. It's just $1 for a week trial. Go check that out. Learn all about exercise prescription for the lower back. And you'll be great at working with these folks. All right. How to fix lower back pain in the gym. Here are the 4 steps to success. First, you want to find tolerable substitutions for aggravating movements in the gym. This is probably going to be squatting and deadlifting and sometimes the Olympic lifts. Okay. Step 2, strengthen the lower back. And we're going to focus on the injured area and all the helper muscles that surround the injured area. So the injured area is going to be most likely the lumbar spine, right? We want to focus on strengthening the glutes, the hamstrings, and the quads, because those are all helper muscles for squatting and deadlifting, right? Over the course of time, we progressively overload. So you start with easier exercises and you work your way to harder exercise over the course of time. And then as we get to the point where we're tolerating more and more strength training, we start to slowly transition back to our prior strength training program. Okay. So should you continue squatting and deadlifting with lower back pain? So the short answer is going to be yes, you should, because squatting and deadlifting can actually help you with your lower back pain. The long answer is going to be it depends. Okay. So, as a physical therapist and a trainer, my number one priority for patients is to keep people in the gym training as much as possible. Okay. Exercising has a myriad of health benefits. One of the major reasons people fall off the wagon from an exercise perspective is because they have some sort of injury, especially low back pain. Low back pain is a huge problem. Okay. I want people working towards their fitness goals as much as humanly possible. Okay. I don't want to take people away from training. However, priority number two, I have to respect the injury site. If I apply too much stress to that area, I can worsen the area, right? I can make the injury hurt more, all right? Or I can perpetuate the pain. So I can keep the pain sticking around for longer than you want just because we're irritating it, okay? But the flip side of the coin, if we don't apply enough stress, then sometimes we don't get better over the course of time, okay? So we don't want to stress it too much. We don't want to stress it too little. It's kind of like Goldilocks and the Three Bears. We have to find the perfect heat porridge to make the lower back happy. All right. And priority number three, and we just covered this a little bit in priority number two, is you actually want to stress the injury site a little bit. We know that strengthening heals pain. Strengthening is one of those things that helps people get out of pain. Okay. And this is a really nice win-win situation because most of the folks that we're working with, they want to train in the gym. They want to get stronger, okay? And when they have lower back pain, the thought is you can't continue strength training because you have to let this area heal. Well, you might have to back off of things that bother it temporarily, but strength training is actually going to help you, A, work towards your fitness goals and strength goals, right? But B, it's actually going to help to rehab the area to help you get out of pain, all right? Pretty cool. How do we modify training when I've got lower back pain? You just told me it's important to continue exercising, all right? But anytime I go in the gym and I try to pick up the barbell or deadlift, my back feels like garbage, okay? So let me guide you through this process, and we want to make sure that you're doing this in a smart way, all right? So our goal as a physical therapist for our patients is to find the hardest and most similar exercise variation the lower back tolerates well with minimal pain on a given training day, right? So the guidelines I'm usually giving my patients, I want your pain to be less than or equal to about a 3 out of 10 on a 0 out of 10 VAS pain scale, all right? The other piece is that we're looking for minimal soreness in the day after you end up strength training, okay? So if you work out and your back feels phenomenal, okay, and the next day your back feels terrible, you did too much the day prior, okay? And this is hard for patients to wrap their heads around. They're often very confused because they'll go to the gym, they'll work out, and they're like, I feel pretty good, but then the next day I just feel like garbage. I don't know what I'm doing wrong, right? And I think the issue is that they have a bit of a delayed alarm system. So their back is not really telling them that they should back off in the moment. And then the next day it does. It says, hey, I'm going to hurt because you did too much. Okay. So keep that in mind. If your patients are feeling like garbage the next day, they probably did too much, right, when they were working out. The big thing that we're looking for is some sort of progress from week to week and month to month. So if I have someone that's having some pain in the gym and maybe they are a little bit sore the next day, right? But I find week after week, they're adding more weight to the bar, their pain levels are going down, then I don't really care too much how much pain they're experiencing because it seems like the pain's not that important. They're actually making progress. They're on the right path, okay? However, if someone's not progressing, they're getting worse or they're staying the same, you're probably gonna have to change something, okay? So here's the reality. Some folks will be able to get away with minimal modifications to their training and keep on going. Some will need more drastic modifications, and a small subset may need to completely eliminate anything that resembles a barbell, right? So in folks that have severe radicular low back pain, I sometimes can't get them to get in the car and drive somewhere because it hurts so bad just to sit down, right? So for these folks, I'm probably not sending them to the gym. I'm probably having them do easy, basic stuff at home, maybe some walking, maybe some bird dogs, glute bridges, easy stuff. And then once they get to the point where they can tolerate a little bit of sitting, they can get in the car, drive to the gym, and then they can start doing a little bit there. I'll have them do that. But initially, I might have to back off a bunch. You're going to have some folks that have pain that they can't, the only thing they can not tolerate is a deadlift above 80% of the 1 rep max, and everything else goes really well. And the only thing they have to modify is a deadlift. Okay. So there's a large variety of people out there. So step 1, let's attempt to modify load of a given movement, let's say a squat or a deadlift, before we find a new variation. Okay. So let's say I'm supposed to deadlift on this day 1 of my program says you have to work up to 90% of your 1 rep max and do 4 sets of 3 to 5 reps. Okay. I'm just making that up. And you find that once you get above 80%, your back says, I don't like this. This feels bad. All right. So we have a variety of things we can do in this situation. For one, I actually want to continue deadlifting if possible. Okay. And we want to try to reduce the load because the load in this example is what's giving someone the problem. So we have a couple options. For one, we can reduce the RPE, or the rate of perceived exertion. So let's say that today we just work out at a 7 out of 10 challenge versus a 10 out of 10 challenge. Okay. So I'd knock a little bit of weight off the bar and I'm still training, although a bit lighter. Okay. Now I have some podcast episodes, Fitness Pain Free Show episodes you can check out that look at RPE training and whether or not you should train to failure. And spoiler alert, you don't have to train to failure to make a change in strength. Okay. So if you knock off a little bit of weight for 1 or 2 sessions, then you're actually going to make about the same progress as opposed to pushing harder. Okay. So respect your injury, live to fight another day. The other option we have in order to train the movement without as much pain is to slow down the movement a little bit. So let's say you're supposed to deadlift heavy, right? But you can't deadlift heavy because your back is hurting. If we slow down the movement, let's say we add a 2-second on the way up and a 2-second on the way down and make it a tempo deadlift, or we do pause reps where we have to pause on the floor, mid shin, and at lockout, all of a sudden the load has to go down. However, we still get a lot of time under tension and we're getting a good training effect, but we're respecting the injured area in a way that doesn't get irritated. Okay. And the other easy way to reduce load is just to increase the repetitions. So let's say we're supposed to do 4 sets of 5 reps, right? Same example in deadlifts. Let's say the back doesn't feel good when we go heavy, but if we stay lighter, it actually feels quite good. And instead we do sets of 12 repetitions. We do 4 sets of 12 repetitions, right? The back feels phenomenal. We have a great training effect for the day. Maybe we didn't go as heavy as we like, but we respect the injured area, right? And we apply the right dosage of exercise. And that session built a bit of strength, built a bit of muscle, maybe not as much as we would like, right? At least from the strength perspective, but it's going to allow the area to heal, right? And that's what we're looking for. Okay. So let's say you try to start loading up the deadlift and it's not working. Your back just feels terrible when you're trying to increase the weight, right? And you're like, you know what, Dan, I tried to slow down the movement. I tried adding some pause reps and nothing was working. My back still feels terrible. In this case, we attempt to find a similar movement, so a modification that we can perform that day that's going to be as similar as possible to the deadlift without irritating the spine, okay? The big mistake that I hear my patients make is that when their back hurts and they're supposed to, let's say, squat for the day, they might say something like, well, squats were hurting, so I stopped all lower body exercise. I just stopped training my lower body because I figured I shouldn't exercise, right? And that's not good because we want to apply a similar training effect. We want to make sure we keep on working towards our fitness goals, right? And applying some stress is going to help us heal, right? The other mistake people will make is that they'll say, hey, you know, squats hurt my lower back, so we substituted a bench press, okay? And again, bad for similar reasons, right? We want to make sure that we're following a program that takes us towards our fitness goals and want to apply a little bit of stress to the injured area. If we choose a bench press, we're just not doing that, okay? We're doing something completely different, okay? So how do we modify a squat when we have lower back pain? So I have a really cool set of infographics for a bunch of different exercises coming up. So if you're listening to this via podcast, I highly recommend you check out YouTube and look at these infographics, all right? I have these all over my website as well. I'll put these in the show notes, right? I have a great article series with all of these modifications. If you want to check them out, then definitely click the link in my show notes, all right? So I have these infographics. They are called modification ladders. And basically, we take the hardest exercise variation for the lower back, right? And we give you a variety of different exercises that are slightly easier until we get the easiest variation on the far right, okay? So on the far left, the most stressful squatting exercise for the spine is probably a low bar back squat with full range of motion, okay? If I switch to a high bar back squat and I stay a little bit more upright, it's a little bit more spine friendly. If I switch to a front squat, that's even more spine friendly. If I switch to a goblet squat, even better. And lastly, if I can't tolerate any squatting for the day, I might try a split squat variation, right? With a lighter load and maybe a partial range of motion. So I can still train my lower body, but not irritate my spine, okay? And the goal is to pick the hardest variation or the most similar variation to what you're supposed to do that day while respecting the injured area. What about deadlifting? So on the far left, the most challenging movement for the spine from a deadlift perspective is probably a conventional deadlift. Okay, so just a barbell from the floor. You can maybe make the argument that if you added a deficit, that'd be a little bit even more challenging for the spine. All right, but suffice to say, barbell conventional deadlift is probably the most challenging for the low back. One variation you can try that automatically makes it a bit easier for the back is going to be a low handle trap bar deadlift. So you're still picking the bar from the same height, but the knees can travel forward a little bit, reduces some of the shear force on the spine, increases the moment arm for the knee to produce a little bit of help, and it's a little bit less stressful for the low back. If the low handle doesn't feel good in the trap bar, you can try a high handle. So that's going to incline the torso a little bit further, a little less stress there. If that's feeling bad still, we can try an elevated kettlebell deadlift, right? So kettlebells are implements so we can't load as heavy. So we decrease the load automatically just by adding a kettlebell as opposed to a barbell or a trap bar. If that's not working out well, we can try hip thrusts. Hip thrusts are actually an amazing exercise because they have a similar EMG muscle recruitment, right? So the spinal erectors, the glutes, the hamstrings are all going to fire in a similar way as they would during a deadlift, okay? What's interesting about a hip thrust is it doesn't compress the spine in the same way that a deadlift does. So because of that, you can work very similar muscles without the same type of pain that you would normally experience with a deadlift, right? And if the hip thrust is not working well, you can also try a single-legged deadlift. It's one of the easier movements on the spine. And what I will say is that if single-legged deadlifts still don't feel good, you can try more quad-dominant single-legged exercises like a lunge, like a step-up. Just keep in mind you're moving further and further away from what the deadlift is supposed to accomplish, right? How about cleans? How can we modify the clean? So a full squat clean is going to be the hardest variation you can do on the spine, okay? One of the easiest ways to reduce stress on the spine is to go from a full clean, full squat clean, to just a power clean. And it's because we're eliminating the entire squat portion of the lift, right? However, if the back doesn't like the squat portion of the lift, then you can turn this into a power clean, right? The other thing that's pretty tough for the back is pulling from the floor, right? So if your back doesn't like to pull from the floor, you can do a hang power clean. So we're limiting the squat and we're also eliminating the pull from the floor, two things that are very tough for the back. And the last thing that I will change if folks can't tolerate either of these variations is I do the clean from a high hang position. So we're literally staying very upright. It's a small dip. And then we drive up, catch the bar in the front rack position. And the spine never gets in a very inclined position. So the stress on the spine never gets that high. Okay. So generally speaking, this is pretty well tolerated for the lower back. If someone is not tolerating Olympic weightlifting, then I'll try to utilize some sort of deadlift variation as opposed to a power variation, just because speed is one thing that lower backs tend not to like when they're really irritated. So I'll try this entire ladder. If that doesn't work out, I'll try some sort of hinge variation instead. Okay. What about the snatch? So for the snatch, I do the same exact system. So the full snatch with a squat is going to be the hardest variation on the spine. If it's not feeling very good that day, we'll try a power snatch. If that's not feeling good, we'll do a hang power snatch. And if that's still not feeling very good, we'll do a high hang power snatch. What I will say is that most folks, if their back's not that irritated, they're going to be able to handle one of those variations. Now, the jerk can also be something that's a little bit irritating for the lower back. However, when you jerk, you're more extending the spine as opposed to flexing the spine like the bottom of a squat or clean. So in some folks that have flexion-based low back pain and radicular symptoms, they may feel absolutely fine in a push jerk. But for other folks, they may actually feel pretty terrible when the back extends. So if someone doesn't feel good when they're doing a split jerk, first thing I'll try is going to be a push jerk. The reason why I like this is because your trail leg is now not behind you, right? Your feet are right next to one another. That usually is going to help to posteriorly tilt your pelvis and keep your spine in a more neutral position. All right. But if jerks aren't going well for the day, I'll switch over to some sort of overhead press. Okay. So that's usually a barbell press, dumbbell press, half kneeling dumbbell press, or even a seated dumbbell press if you want to take out that core demand a little bit. All right. So, one really big honorable mention for training in the gym when you have low back pain is going to be utilizing blood flow restriction training. Now, if you haven't heard of blood flow restriction training, or BFR for short, you take blood pressure cuffs, you wrap them around your legs, right? Around your thigh, as high up around the leg as you can. And you're going to put it to 50% of occlusion pressure. So 100% occlusion pressure, let's say it's 250 millimeters of mercury. I'm making that up. You would take half that number and you would train at what's that math? 125 millimeters mercury, or excuse me, 80%, not 50%. It's 50% for the upper extremity, 80% for the lower extremity, right? And then you perform reps of whatever at lower body exercise you like at 20% of your 1 rep max. And the reason why this is so nice is because you're using a light weight, which tends to be very friendly on the spine, and you're going to increase strength and muscle mass at a similar rate as strength training, which is amazing, right? So I recently hurt my back. I've got a picture of me squatting, right? And I have my heels elevated because that's going to decrease a little bit of the stress on my spine. And I'm holding a sandbag out in front of me, which is another way to keep my spine nice and upright, okay? And it's a pretty light sandbag. I've got BFR straps on, and I'm squatting. And I'm trying to do 30 reps in my first set, followed by 15 reps, 15 reps, 15 reps on my next 3 sets with 30 seconds rest in between. This is just one of the protocols we found through research to be effective for increasing strength and muscle mass, right? And adding these cuffs kind of tricks the muscles into thinking they're being loaded heavily. And the reason being is that when you exercise, you create some cellular swelling. So you create a pump sensation, right? And you also have this burning sensation that occurs from acidic byproducts building up in the muscle. And normally when you have regular blood flow through the area, it's going to get rid of the cellular swelling. It's going to get rid of the acidic byproducts very quickly. But because we're restricting some of that blood flow, the swelling stays and the acid stays. The muscle fatigues faster, right? The muscle kind of thinks it's being heavily loaded just because there's so much swelling and so much acidic byproduct in that area. It fatigues, right? And that fatigue is what drives the growth over the course of time, right? And what's awesome about this is that this day when I went to the gym, I was supposed to squat and my back felt like garbage, right? It was one of those days where I couldn't even bend forward to touch my toes, right? As soon as I start to bend forward, my back would just seize up. And I actually tried to put a barbell on my back, and my back's like, what the hell are you doing? And I was like, okay, I'll stop. I tried a few variations to see if my back could handle some loading. It just wasn't happening. So I got the blood flow cuffs. I put them on my upper thighs. I pumped them up. And then I did 30, 15, 15, 15 of a nice and upright squat with a sandbag. And my back felt great. And my legs are nice and sore today. So I actually feel like I got a good training effect. And I made some progress. And I didn't feel like I was limited a ton by my low back pain, right? Which is great. So what's the next step? We need to strengthen the spine. And like I said earlier, we want to focus on the injured area and we want to focus on all the helper muscles. So where's the injury site? It's your lower back. It's a lumbar spine. If you have radicular based low back pain, you've got an injury right in your spine, right? And what are the helper muscles we want to target? The glutes, the hamstrings, the quads, and the calves. Basically, all of the lower body exercises, or excuse me, lower body muscles that help you squat, deadlift, Olympic lift, all the lifts we want to get back to. At the end of the day, we want to build a balanced program. So that means a total body training program that has some sort of core strength with it, okay? And for the majority of folks, if you're already active and training in the gym, you should have a balanced program, right? So all we're doing is adding some additional strengthening exercises to those helper muscles, and we're modifying your main lifts that are aggravating, okay? And over the course of time, we start with easier exercises and progress to harder exercises, right? And you can utilize those modification ladders I showed you before in order to do that. Okay. So I have a program to the right here. And I apologize again, if you're listening to the podcast version of this, you're not going to see it, but definitely go on YouTube and check it out. I have a rehab program that I used recently for a patient of mine that I saw that had radicular low back pain. And he was actually a couple weeks out from radicular low back pain. He was feeling quite good. So he wasn't a super painful person that comes limping through the door. He was someone that was painful limping through the door. Definitely had some neurological issues down one side leg. The majority of that was gone at this point, and he's back to the gym and exercising. So what we did was we modified some of his squatting and deadlifting. We basically gave him some higher repetitions and gave him some more friendly squat and deadlift variations. And then I gave him this accessory program right here. So on day one, you'll see we have a GHD back extension, followed by a lateral pillar hold. So if you've never seen those before, it's kind of like a side bridge on a GHD machine. They're extremely hard, right? Followed up by a lateral bear crawl. And then lastly, a dumbbell single arm row. Dumbbell single arm rows are a sneaky upper body exercise that works on your core. It's an anti-extension rotation exercise. So you're getting a lot of lower back strength by doing that exercise, even though it's an upper body exercise. On day two, we added a barbell hip thrust with a pulse at the top to focus on getting his glutes nice and strong. We followed that up by a dumbbell suitcase carry, which is a phenomenal exercise for the musculature on the side of your core, right? We added a plank with a plate drag, so some core exercise with a rotary component. And lastly, a cable pull through, which I love because it's going to strengthen the same muscles that you need for deadlifting and squatting. On day three, we have a transformer bar good morning with a 2-second lower. I love good mornings because I think it's one of the most challenging exercises you can do to strengthen the lower back. Although this man was a little painful, so we added a bit of a tempo to it. So a 2 or 3 second lower and go nice and light on these initially with the idea that over the course of time, we can start to load it up more. Second exercise is a dumbbell single-legged remaining deadlift. Great single leg strengthener, working on the posterior chain. Followed up by a physio ball stir the pot, another core exercise, and lastly, a landmine press. Now, the landmine press is similar to the dumbbell single arm row in that it's a sneaky upper body exercise that helps to strengthen the core. So in this case, we're working anti-rotation and anti-flexion at the same time, right? Now we're getting some good core work, even though that's an upper body exercises, okay? So this is just an example of a program that I've given to one person. At the end of the day, you're gonna have to choose movements that fit where the individual is in terms of rehabilitation, right? If they're super, super duper irritated, this is going to be way too much, right? And let's say the person is a little bit further out and they're doing better than the person I just worked with. Maybe they need even harder exercises, okay? So you have to judge based on the person that's in front of you, their subjective and how they're progressing over the course of time, and give exercises accordingly based on how they're doing. What are some strategies from a rehabilitation perspective for folks that have a lot of neural tension, okay? They're dealing with radicular low back pain. Well, first and foremost, I think it's really important that you progress slowly, okay? And this is an anecdote, okay? I don't know. I've been a PT for about 10 years now, a physical therapist for about 10 years. I've been doing personal training for close to 20. I've been competed in strength sports for a couple decades now, right? I'm really, really into fitness, okay? I've been in the trenches for years. So this is just what I've seen over the course of time. It's not as evidence-based as I'd like it to be, right? But if you look at some of the research, the majority of disc symptoms resolve in somewhere between 2 and 12 weeks, with majority of those getting better in about 6 weeks, right? Now, as a physical therapist, we tend not to see these folks, okay? Because when people get better really quickly, they don't come to a physical therapist, okay? They don't go to their doctor. They don't get sent to someone like me because things get better really quickly, all right? But do keep in mind that the large majority of folks, and remember that research that I showed you about folks with disc issues, the majority of those get better, and the majority of those get better very quickly, right? So despite disc issues and radicular issues being very scary, they tend to get better very quickly, okay? That being said, of the folks I've worked with radicular low back pain, if I didn't go slowly enough, they would just flare up really quickly and their life would be absolutely miserable, okay? So here's the thing. If you have a patient that's not getting better, right, over the course of time, has made no progress, especially if they're 12 weeks out or so, then you can consider A, changing something, or B, sending them back to the doctor for additional treatments. Okay. Here's the thing, if they are making some progress, great, keep going. But this may take a long period of time. I have some folks that have had some severe radicular low back pain, and it took them years to get to the point where they feel like they can heavy squat and deadlift again. But here's the thing, they get back, they can do it, it can happen. Okay. So just be prepared to go slowly, a little more slowly than you would with someone else that has a different type of pathology. And the majority of folks over the course of time are going to get better. Okay. And just want to prepare you that this doesn't happen to you, but I have certainly flared people up by trying to go a little too fast. I would say this is not the type of pathology you want to push aggressively. It's one of those ones you just want to progress nice and slow, and maybe take an extra week of doing a particular set of exercise before you jump to the next hardest thing. Okay. That's all. So here's what I want you to do next, guys. If you enjoyed this video, I have an entire course. It's free. It's called the Fitness Pain Free Mini Course. And we go over 3 lessons going to help you take a lot of this information that we went over so far and put it into practice. The first lecture is called Why We Need a Better System. So first and foremost, the way we treat fitness individuals, all right, athletic people in the gym from a physical therapy perspective is pretty much broke, okay? So we need a better system to serve the folks that are in the gym that get hurt, they want to get back to training, all right? Lecture number 2 is called 7 Reasons Why People Get Hurt in the Gym. And essentially, we have to know the reasons why people get hurt in the gym so we can keep them safe in the future, right? And when they get hurt, we have to know why and how to get them back to training in the gym. Okay, so a thorough understanding of this is very, very important. I actually have a really cool infographic that goes along with this lecture that you get for free as well. And lastly, we go over a case study of how to get someone out of pain and back to training. So these principles are all phenomenal, but we don't actually put it together and you don't understand how to create a program to get people back in the gym and keep them safe for the long term, then we lose, right? So I'll put a link in the show notes for this. It's a Fitness Pain Free Mini Course. Definitely check this out.